there, Marshmallow Warriors. Welcome back to Medicare Tales and Marshmallows, where the cocoa's hot, the policies are confusing, and the guests are real folks trying to make sense of it all. Today's topic: too many plans, not enough patience. Because if you've ever stared at a list of Medicare Advantage plans and thought, why does it sound like I'm ordering off a secret menu at a health insurance diner? This episode's for you. Joining me today is someone who survived the great plan selection spiral and lived to tell the tale. Welcome, Shirley T.
Thanks, Kem, and I did survive, but barely. I aged 5 years and burned through 6 yellow highlighters.
Okay, Shirley, you turned 65, got your red, white, and blue Medicare card, and then what happened?
Then I opened my mailbox and got blasted with brochures with scary alphabets and acronyms. I'm talking HMO, PPO, PFFS, MSA, DSNP, CSNP. Oh, by the way, it was one of my neighbors who told me that these SNPs are actually pronounced as SNPs. I was like, who cares? It's still all confusing, and it all felt like I was being recruited by a bunch of health plan biker gangs.
I've seen alphabet soup with fewer letters.
Exactly, and every plan claimed to be easy, comprehensive, and tailored to my needs. One even had a puppy on the cover. I nearly joined just for that cute dog.
What was the hardest part?
Figuring out what each plan type actually meant. I have them all color-coded and can practically recite off head like ABCD. You ready?
Born ready. Go for it.
HMO, can't go out of network, as in never. PPO, more flexibility, but may pay more money. PFFS, I still think that stands for please figure this stuff. SNPs, DSNPs, that was the easiest. D for dual, for those who qualify for both Medicaid and Medicare. I had to Google what a CSNP was. I thought it was a gene mutation until I discovered C for chronic conditions. And apparently you can't have too many SNPs, so there's also an ISNP.
Okay, that one sounds like a spy agency. I spy.
Right? Welcome to ISNP. We manage your care and your secrets. Turns out I is for institution, for example, those residing in an assisted living facility or any other institution. I was like, who cares? It's still all confusing. Let's see, what else? Oh yes, an MSA plan popped up, and I thought it was a Medicare savings account, but it's also a plan with a deposit?
My head hurts already. So how on earth did you finally land on a plan?
I made a spreadsheet, then cried myself to sleep trying to analyze it. But eventually I got help from my local SHIP counselor, bless her, and narrowed it down based on my doctors, my prescriptions, and my travel habits. I visit my sister in Arizona a lot, so a PPO made the most sense.
Ah, so you picked a PPO.
Yes, because I needed flexibility. I have a friend who chose an HMO, and according to her, because it had her doctors, meds, and the fewest moving parts. Not even sure what that means, but not for me. I don't need an HMO telling me which doctor is in the family. No offense, but I don't want my health plan to feel like the mafia.
As in, you come to me for prior authorization on the day of your annual checkup.
Exactly. I just wanted choices without coverage surprises.
Makes sense. What about costs? Any surprises there?
A couple. I didn't realize the specialist copays would be higher than my old plan, and my vision coverage only kicked in after I passed a certain number of full moons, or at least that's what it felt like.
Interesting. Okay, final verdict. Are you happy overall?
You know what? Yes. Now that I understand the rules, I feel confident. It's just getting there that was the journey, like a Medicare escape room with a phone tree and confusing maps.
You are a brave soul indeed. So, Shirley, knowing what you know now, what would you say to someone turning 65 next week?
I'd say, 1, don't panic. 2, get help from your state SHIP resources or a licensed agent. Just don't go it alone. 3, ask yourself what matters most: your doctors, your meds, your freedom to travel. Then finally, pick the plan that fits your life and wallet, not just the one with the prettiest brochure with a picture of the cutest, happiest dog.
Shirley, you're a gem. Thanks for sharing your wisdom with us. Folks, that's all for this episode. Until next time when we return with another marshmallow-worthy Medicare mystery. Remember to roast a marshmallow, call your state SHIP or a trusted agent, and always study the plan alphabets like you're back in kindergarten.